You're a martial artist, so like my mentor taught me that when you push out, people push in. So if you're giving, then people are like, whoa, I want to be around this guy. I love Letip because it's like my Letip family. These days I wake up really early, and earlier than normal. I wake up at 5:30, get ready, and go to the Lake Grove Diner where I meet with my Letip family. I actually met my husband in Letip, so it's given me not only business value but personal value. Good morning, everybody. Liz Martin from Hands-On Acupuncture Massage Therapy, the modern family medicine practice that utilizes the 4 pillars of East Asian medicine. First of all, I have to thank you guys. Thank you so much for your support and love, and I love that you guys think of me for your care for everyone, and it's my true pleasure to take care of you guys. I'm all about giving value, so a great tip I like to give you guys is you grab more attention when you're giving value. So something that this time of year everyone's getting headaches. It's seasonal allergy season. It's the time of the wood elements, so that's the energy of the season. So headaches, gallbladder, liver channel in Eastern medicine. A good point to do is on the back of the head. It's called GB20. You can find it by grabbing the back of your head. It's right on the occipital release, and you can rub this. This will help any type of headache that's stemming on the top of the head, on the side, the temples. It's a great for a stress reliever. So, so thank you so much for having me today, and hopefully this will help your headaches. So, thank you very much. 2 tips. Like today, I went to Letip and I said to them, I'm all about giving value. So instead of saying, oh, a good tip for me would be somebody with allergies, what I said is, oh, I'd love to give you guys a tip. A good point for headaches is GB20. And I literally went up to that, I just stood up and I said, this is how you do it. And people love that. They were like, oh, and then everyone's like, oh, headache, GB20, what's GB20, So it's a bunch of professionals that meet together, and they're one category for each profession, and I'm the acupuncture category. We're looking to put the massage therapy category. But I love it. It's just super empowering to be around people that are like-minded. I feel uplifted when I leave there because a lot of people are very successful in their categories, and it's just great to surround yourself with those weird, crazy entrepreneurs that have a very different type of thinking. And it's just nice to know them and be surrounded by that atmosphere and environment. So today is normally my admin and new patient day. I like to spend the time with the patient, so we allot a certain day for that. So today I'm going to be seeing 2 new patients. So as far as whenever you take an antibiotic, what happens is your body clears out all of the flora, all of the good and bacteria in your body. So whenever you take an antibiotic, you want to follow it up with a probiotic. But I'll write it down for you. Because with the probiotic, what it is it's good bacteria that goes back in your system. How are you feeling emotionally? Good? Start doing live every week, every Tuesday, so look out for our live sessions. Today we're going to be talking about vertigo. I was actually talking to Corey about vertigo symptoms. He knows somebody that is feeling that, and he was asking me about it. So it prompted me to do a live. So from what vertigo is from a Chinese medicine standpoint, we actually, when we're doing diagnosing, vertigo is a symptom. So as a Chinese medicine practitioner, what we try to do is we try to figure out what the pattern is. So there's always an underlying cause why you have vertigo. Sometimes it's blood deficiency, sometimes it's liver qi stagnation. This is Chinese medicine lingo. Sometimes it's your diet. So there are some quick tips that you can do to help prevent vertigo. You know, sometimes vertigo is associated with ringing in the ears. I'm going to meet up with our new massage therapist. We're going to train him a little bit and talk about what's expected in the practice. It's just practice. Like, you have to practice with kind of dumbing down things for the patient so they understand. Like, not dumbing down, but, you know, like creating lingo that makes sense for them. Like this is how we do it in acupuncture. Somebody's like, well, how does acupuncture work? And honestly, like, depending on who I'm speaking to, like, you don't talk to a baby the same way you'd talk to like an adult with a PhD. So like, I kind of, you have to come up with certain ways of explaining things that make sense to who you're to your audience, you know. So if maybe somebody that has a Western background, I know, like, maybe a doctor comes in here and I explain how acupuncture works, then I use my Western knowledge, and I'm like, okay, so if somebody comes in for acupuncture, what happens is it stimulates the nervous system and it releases certain neurotransmitters in the brain that send a signal for the body to release. So like, that's a very simple answer. So if somebody with a PhD maybe comes in, well, how does massage work? Well, massage, you know, what is a knot? Like, what is that? People ask me that all the time, like, what is that? And I'm like, well, it's the muscle fibers coming together, and what massage does is help, you know, break up those muscle fibers, and it helps flush out the toxins within you. And sometimes you're sore after a massage because we're breaking up those things. Like, I want you to get real comfortable with educating the patients, because I notice that there's a lack in educating the patient. Somebody will get a massage, they go home and they're sore, and they're like, that sucked. That person was horrible. Like, you know, so like, I'd love for you to get comfortable saying, you know, you may be sore, make sure you drink a lot of water. If you don't drink water, you're going to be sore. It's your body, it's the lactic acid buildup in your system. And when we're doing massage, we're breaking up those tissues. So your body needs water in order to flush out the toxin. The idea is, so you're going to be here on staff, but the idea is you want to turn them into a patient of yours. So I want them to get to know you, feel your hands. What we're hoping for is that person stays an extra 15 minutes or a half hour or an hour. What I'm trying to do is set it up. We have to actually set up the community room to make more rooms. This way the flow of the patients coming in won't be interrupted if somebody decides to stay on for a massage. So my goal with having you on staff is really, first, to give back to the patients, to give them more time for massage, but then also to expose you so that you can develop those reoccurring clients or patients. So I'll tell you a little bit about how acupuncture works. So in this office, we have treated specifically a lot of carpal tunnel, ulnar tunnel. They have, you know, where there's like an entrapment of the nerve. Basically, it's not fire. Like, it's pressing on the nerve. What's happens is, you know, we'd have to do a full diagnosis on you, and we'll bring you in and everything. Right. But just from a general background, acupuncture is really great for any type of pain, especially any type of nerve pain, because what it does is it helps bring circulation in the area, and it helps your body to basically heal itself. So it kind of brings attention in that area. So typically when you have a block, when you have pain like that, it's something pressing on the nerve. I'm going to do a one-on-one meeting with Mike, my associate and other acupuncturist. Just wanted to check in, see how's it going. I just want to make sure I spend some time with you guys and just go over how you're feeling, how the progression of the transition of everything, of the improvements, and you feeling good?
I'm enthusiastic.
Yeah. I'm really proud of the growth of everything that's like the flow, the chi that's in here.
Good.
I love the way that you're handling like multiple patients. Okay. That's great. In order for you to feel, it's important for you to take a vacation. This way you're refreshed, like that you come back and you're able to treat people, like, because otherwise it's just, you know, if you're not taking care of you, then you're kind of just in it, and you're just like a drone, you know. So, but you're still feeling good. You do qigong yourself, and you're keeping on top of that. People love it.
Introducing in the Tai Chi class?
Yeah, people love it. The handouts and everything. It's great. And my mom's really happy. She's the happiest she's ever been, I think. So, and I think it's because of your acupuncture and Tai Chi.